I just wanted to say thank you for inviting me to come and speak today. I'm going to be just giving a very, very brief overview of autism spectrum disorders. My understanding is that some people in the room will have a lot of knowledge about autism spectrum disorders, and then others maybe this is the first time they're hearing that, and so I apologize to those of you that I'm giving too much detail, and to those of you that I'm not giving enough, I'm happy to follow up afterwards with some more information.
You guys all here? Georgina? Dr. Peacock.
And just a little bit about myself. So I work at the CDC. I came to CDC about 6 years ago to work on the Learn the Signs Act Early program, which is a program that I'm going to talk about just a little bit at the end, which focuses on the early identification of helping parents identify signs and symptoms in their children so that they can get the interventions that they need as soon as possible. And I also do see patients a few times a month at the Good Samaritan Health Center in a developmental clinic that where we see patients that are either low income or need appointments and are not able to get them. So autism was first described by a psychiatrist, Leo Kanner, in 1943 in the United States, and about the same time, in 1944, Hans Asperger also described a similar set of patients that he described having autistic psychopathology in Austria. And so the group of patients that he talked about were later used to describe people with Asperger's syndrome. And as maybe you all don't know, autism was once seen as a relatively rare condition, and what we have found, though, is that as we have gotten better at figuring out sort of who has autism, we have found that it's not as rare as once was thought. So we have about 4 million babies born each year, and so when we're thinking about that, eventually, if we look at the data, about 1 in 6 children will have a developmental disability, and about 1 in 88 will be diagnosed with an autism spectrum disorder. So the reason why the CDC is involved in the early identification of children with autism is that we believe that it is a public health concern in that children with autism or developmental delays are at risk for poor outcomes, especially if we don't give them the services and the interventions that they need as soon as possible. That early intervention can significantly impact important life skills. So the earlier we can identify children, the earlier we can intervene and help them to give the families and those children the skills that will help them to be successful. We all know that many children are not diagnosed with developmental disabilities until kindergarten or later, and that we know that children that are low income or from minority families experience longer delays in receiving services. So now I'm going to play for you a clip of two 19-month-old twins, one who was ultimately diagnosed with an autism spectrum disorder and one who wasn't. And I'm just going to let that play to show you that there are differences in signs that we can see from a young age. These two twins are 19 months old.
That's right.
obviously from a small clip and from that amount of time, that's not sufficient enough to diagnose a child with an autism spectrum disorder, but I wanted to show you a clip where we certainly see some warning signs in the second child that we saw, not engaging with the play and not engaging with his mother as much as his brother. And just as an aside, this video, as well as there's about 30 videos in a video library that we have on the Learn the Science Accurately website, is part of an autism spectrum disorder case curriculum that's used to teach pediatricians and other healthcare providers about the early identification, diagnosis, treatment, and anticipatory guidance for children with autism. And I'll speak to that a little bit at the end, but there's some handouts. They're on the tables that will have our website on there. And if you look at information for healthcare providers on the website, you'll be able to link to this whole curriculum and find more videos that also show other things to look at. Oops. So autism spectrum disorders are not recognizable at birth. And we will hear, I think, later in the panel some things about maybe some earlier ways that we're learning how we can identify children, but in the current state, it's not recognizable about birth. And typically, children who are diagnosed with an autism spectrum disorder will have that lifelong. It's a complex disorder, so there's lots of different areas that are affected. And there's really a wide range of impairment. Some children have a few challenges, some children have more, and they may have more challenges at different times during their childhood as they're growing up. And so this really also speaks to that, where we can see that the characteristics that we describe in children with autism spectrum disorders can vary. Their social interaction can vary from being very aloof or maybe passive, or more active in their social interaction. Their communication, there are people with autism spectrum disorders that are nonverbal, and there are others that are quite verbal and can be quite articulate. And so I think it's important to think about when we're going through these characteristics that what I'm talking about now is sort of the challenges that we see, but there's also a lot of strengths that we can see in children with autism spectrum disorders, and some of them actually can come out of that, what we describe as signs and symptoms of autism spectrum disorders, and with the right supports, those children can capitalize on their strengths and work on their challenges and really be quite successful. The behaviors there may be some intensive, sort of really difficult behaviors. There may be really sort of not a lot of issues with behavior. When we look at intelligence or measured by IQ, there can be children that are quite severely affected. There can be children that would test in the gifted range. And then we look at functioning or adaptive functioning. That's sort of how you work with your skills of daily living, how you take care of yourself, how you get yourself through the day. There can be a lot of challenges, or there can be not so many. And so I think any of you familiar with autism spectrum disorders will know that there's been a pretty big shift this year in the Diagnostic Statistical Manual. We went from what we call the DSM-4 to the DSM-5 this year, which is the manual that psychiatrists and other healthcare professionals use to diagnose different conditions. And so we went from something where we had a lot of categories, and autism fell under the pervasive developmental disorders, to something that we call more broadly autism spectrum disorder. So before, children may have been diagnosed with an autism disorder, they may have been diagnosed with Asperger's, they may have been diagnosed with what people call PDD-NOS, or pervasive developmental disorder, not otherwise specified, which also could have been called atypical autism. Those have gone away, and now there is a broader category in the DSM-5 called autism spectrum disorder. And so the other, and there's a lot of details involved in these changes, so I'm really giving a very broad overview of this. But in the DSM-4, there were really three main categories, which involve social interaction, communication, and then behaviors and interests, or unusual, repetitive, restricted behaviors. And now what's happened is we have two categories in the DSM-5, one focused on social communication, and then the other on the restrictive and the repetitive behaviors. So I'm going to go very briefly through sort of what we see in those, but with the social communication and interaction, what we're seeing is that lack of social and emotional reciprocity, that going back and forth, that social engagement. We may see some nonverbal communication behaviors used for social interaction, and then there may be difficulty developing and understanding social relationships. In the behavior area, the restricted and repetitive behaviors and interest area, we might see some really repetitive motor behaviors or repetitive behaviors that are in speech or in the use of objects. We might see some inflexibility, difficulty transitioning to one thing or another, being fixed or fixated on specific interests, and then we might see some either extreme reaction to certain inputs, sort of like sometimes people will talk about textures in taste, or talk about problems with the feel of clothing, things like that. They may either be really sensitive or pretty hyposensitive or unreactive, say, to something like pain. And so in this category, you need to just have two of those if you're going to make that diagnosis with the new DSM-5 criteria. And then the other things that are listed in that diagnosis is that the symptoms should be present early in the developmental period. That doesn't mean necessarily that you will have fully recognized them early on, but we're hoping that you'll recognize that people will recognize these subtle differences early on, so that we can get children the intervention that will help them to be as successful as they can. And then the other sort of caveat to this is that the symptoms that people are describing need to be significant enough that they're causing difficulty for the child in their everyday functioning. The other, and I'm not really going to go into this in much detail at all, other than to say, because autism spectrum disorders right now are diagnosed based on a behavioral diagnosis, it's often difficult to make that diagnosis. It often takes a number of professionals. It can take a period of time. Sometimes you have disagreement between professionals about what's going on because there's overlap between a lot of these different things, including intellectual disability, language disorders, learning disabilities, ADHD, anxiety, and these can either be a piece of a child with an autism spectrum disorder, or it could be that we're seeing some signs and symptoms, but not all the signs and symptoms that fit an autism spectrum disorder, but the child rather has something else. And often parents are getting different opinions from lots of different people. There may be a child care provider, there may be a teacher, there may be a healthcare professional, there may be an aunt, there may be a grandma, that's all saying that they think there's something different going on. And so I think the important takeaway from that is that sometimes it takes a little while to come to the most appropriate diagnosis, and I think often it's, diagnosis is what I do quite a bit in my clinic, but what I think the most important part of that diagnosis is okay, let's look at the strengths and challenges your child is having, and let's figure out a plan to help support that child. So the more we can focus on the support and the figuring out ways to make a child and a family successful, I think is really the focus that should be there. So this is just a really busy slide, and I think you all will get copies of the slides, is that right? So these are sort of some questions to think about. about, but the bottom line is the change is hard. And so a change from DSM-4 to DSM-5 has caused a lot of anxiety in a lot of people. It's caused anxiety in families, in people with autism, in professional, clinical, and educational professionals, in researchers, and policymakers, because it may or may not be changing the things that we've done for a long time. And so I'm not going to go into a lot of detail, but I think keeping that in mind, that we're in a time where we're learning a lot about autism spectrum disorders, and as change happens, change is hard. And so asking questions and thinking about and keeping a child and that family at the forefront as we're thinking about the best ways to help them, I think is the way to approach this, and not focus as much on minute details, but making sure that we keep the child in the forefront. I'm going to switch really quickly just to talk about the role for early identification. I've mentioned it a little bit already, but in looking at the data at CDC that is gathered, parents report at either educational or so it's recorded in either educational or medical records before the age of 2 that they had concerns that their child they had developmental concerns before the age of 2. But often the diagnosis, if we look at the average age of diagnosis, it was not until after the age of 4. And 82% of children with an autism who ultimately had an autism spectrum disorder did not have a diagnosis by the age of 3, even though our program will say you can find those signs and symptoms between 12 and 18 months of age, and I think we'll be hearing some things later that may even suggest we can see those signs and symptoms even earlier. And then 21% of children with an autism spectrum disorder did not have a diagnosis by the age of 8. So we know that there's a significant lag between that time when parents have concerns and parents are reporting that to their healthcare professionals, to their pediatricians, and when that diagnosis occurs. It doesn't always mean that the child hasn't been getting any intervention. So, the children will get intervention without a diagnosis in some cases, but that full diagnosis of an autism spectrum disorder, there's a pretty significant lag between initial concern and diagnosis. So the Learn the Signs Act Early campaign was started in about 2002-2003, and it has been housed at the CDC, and it really is focused on parent education with the goal of early identification of children that are showing developmental delay, who ultimately may be diagnosed with autism or another developmental disability. And the goal is to identify children early so that the children and their families can get the services and supports they need as soon as possible. So it really has two different parts. The Learn the Science part is really resources for monitoring child development. You'll see there's a pamphlet outside that has a few milestones in it, and then there's a more detailed booklet that's called the Milestone Moments booklet that has milestones for children at different ages, and then things you can do with your child at different ages. And I think, so we can just show what these look like, and I can pass them around, but there's copies out there. There may not be enough out there, but you can also order them from the website, so we can just have these go around. And then the Act Early part is really talking to pediatricians, a focus on pediatricians, on child care providers, on how to discuss concerns they have about a child's development so that child can get the services, or so that child can get to somebody who can help understand what delays are being seen. Proactive screening, so doing developmental screening in child care centers or in pediatricians or other healthcare provider offices, and then knowing where to refer children for evaluation and services, and knowing what those early intervention services are out there. So very briefly, the American Academy of Pediatrics recommends that children have a general developmental screen at 9, 18, 24, or 30 months, and then an autism-specific screen at 18 and 24 or 30 months. And if there's a concern that comes out of either of those developmental screening tools that are usually filled out by parents, that they get referred to have services and supports focused on the needs that they have, and also referred for an evaluation that may be able to more clarify what exactly is going on with the child. So how good are we at this? Well, so when parents were surveyed through the National Survey of Children's Health, we found that you can see right here, so the blue, so the blue right here, about 37%, there was monitoring being done. So the pediatrician or the other healthcare provider, nurse practitioner, the family practitioner, was asking about a child's development, and parents reported in about 37% of the time. In the red part, so 15% there was monitoring and screening going on at the same time. So there was monitoring, just asking questions about development, but then there was actually developmental screening occurring with a screening tool. In about 6% of the cases, just screening was being done, so they weren't asked anything from their healthcare professional about child development, but they did fill out a screening tool at some point in their well-child visit. And then about 42% of the time, and so this is from 2007, but actually it hasn't come up much from this in sort of all of the looking we've done through other sources. About 42% of the time, there was at least a parent perception that there was neither developmental screening or monitoring happening in well-child care. So that was just a really brief overview of both autism spectrum disorder and then what CDC's role is, or one of their roles, which is to work on the Learn the Signs Act Early campaign, this early identification campaign. Obviously, the other role at CDC is the prevalence numbers, which I shared earlier, and looking at numbers of children that are diagnosed and when they're diagnosed and those kind of things. And so if you have any questions, my email is up there, and I'd be happy to talk to you. Thank you.